Sorry about that, the delay. I think we've got things squared away. My bad this morning. I must have not had enough coffee. I think I got things squared away with the Jimmy Buffett tickets. Anyway, we were talking about tummies and what happens to a woman's abdomen during the pregnancy. The foundation gets stretched out and it doesn't go tighten back in everybody. A few people it can, but that's unusual. Usually what we do is we have a situation where this foundation, which is made up of the rectus muscles that have split apart and the fascia that's in between them, is now billowing out like a sail and causing this little pouch that's down here in most women who have had a child. And the only way to fix that is with doing some type of abdominoplasty or tummy tuck, because no amount of liposuctioning is going to solve that problem. So what I do for most what I call mommy tummy is I start off by doing some liposuctioning on the upper abdomen and on the waist area, kind of off onto the hips. Now the reason I do that is because I get a nicer contour when I finish. So after I finish with my liposuctioning, I make an incision that's very low in the middle. It's usually below the hairline. If you have a C-section, it's below that. But it does flare up a little bit on the sides because that's what bathing suits do, and I want to try to keep this under a two-piece bathing suit. Now the length and the location of the incision is different on every patient depending on what your anatomy is. For instance, folks who have had some type of bariatric surgery, weight reduction surgery, stomach stapling, gastric band, that kind of thing, and they have a lot of excess skin, their incisions and their subsequent scars are going to be a lot longer because whatever you have that's extra, I have to get around. I can't deal with extra skin hanging here with a short little incision that's this big. So, but again, the incision that I make is not an incision that goes deep inside you as if you were having a C-section or a gallbladder removed or an appendectomy. It just goes down to the foundation. And then I lift everything up, so now I'm looking at your foundation. And then at that point, I put the muscles back where they were before your first pregnancy. I actually sew them back together with permanent sutures, so I get my foundation nice and tight and firm. So I have a firm foundation to work on. We then actually bend the table a little bit, so you're bent a little bit, and we pull down on this thing that I had lifted up, and I trim off what I don't need, which is usually a piece of you about that big. And I get off every bit as much as I possibly can, get you as flat as I can, and then I put everything back. I actually cut a new hole. It's your belly button. It stays right where it was before, but the skin around it has moved down, so I have to cut a new little hole for it, and I usually make a nicer shaped belly button than you had before. And then I put in my stitches, and I usually put a little drainage tube in and wrap you up in a corset, and off you go. Now this is the second most frequent operation I do, so I do a lot of these. I've done a lot of these, and I continue, to I think be one of the best abdominoplasty surgeons around. Most folks who are at, say, desk jobs are back to work within 5 to 7 days, but I required that there be no heavy lifting, nothing heavier than your shoes or your purse for 3 weeks. So that might, cause you to have some timing issues, especially if you're trying to do this right after you have, or a year or two after you had your last child, because they're going to want to be picked up. You can hold a 2-year-old. I just don't want you to reach out and pick up a 2-year-old. It's a great operation if you can put up with that scar. Now, this scar, as I say, is in a place that theoretically only your very closest friends are ever going to see, and you have to keep in mind that scars take a while to mature. They fade for up to 2 years. Now, when I say fade, I don't mean disappear, I mean fade. A scar is a permanent thing, and everybody's scar is a little bit differently. There are lots of different types of scars out there, and if you want to get an idea of what the variety is, you're welcome to come in over to the office, and I have a large book of befores and afters, and you can kind of see a wide variety of different types of abdominoplasty patients. So that's kind of how that works. Occasionally, if it's a relatively small tummy tuck and a woman wants to have something else done in addition to that, some operations can be done. For instance, if they want to have some breast implants put in, a breast augmentation, occasionally I can do that. But if it's a large abdominoplasty, a large tummy tuck, no, it's just not safe to do that in conjunction with anything else, and I won't do it. So anyway, that's how that works. just want to touch base one more time on an issue of physician selection. Please keep in mind that I'm a solo practitioner, which means I take care of my own patients 24/7. The large groups, if you have a question on the weekend, who knows who you're going to get to talk to you, and they will likely not know who you are, what surgery you had, what your particular concerns are. So we'll go on from there. One more thing about tummies I forgot to mention. Some women will come to me and ask about a mini tummy tuck. It's an operation I have done and I will do on rare occasion, but that's only for women who have problems below the belly button, no excess skin, no excess protrusion up here, and it's a relatively minor operation, but it's also, if you do a smaller operation, you get a smaller result. So, as I say, I will do that operation on a select number of patients, but it's only a select number of patients. You have to understand, if you do a half of an operation, you get half of the result. So, anyway, that's what I have for you today. Again, sorry about the interruption. And when April comes around and I come back, I'll let you know how the show went. Take care.